What has been the impact of the COVID-19 virus on the Namibia health system?
It's not an easy situation. We are all human beings. And we are all touched by the situation. During my clinical practice, if I lose a patient, I always go and reflect and say, is there anything probably which I could have done to save this patient? Did I miss out something? It's always depressing to experience such a phenomenon. On the other hand, there is a balance that when you see a patient coming on the verge of death, and then after that the person is moving, is going out, healthy, recovered, that is your best reward. And those encourages you throughout the good and the bad.
Healthcare workers has been exposed for more than a year, stressing ourselves, mentally getting into issues that we never thought. It's not easy to see 6 people dying at the same time. It's never easy, but we have to go through. Even if you are down, you have to compassion and comfort those relatives and continue, because there are others also waiting for your services.
This is something which can be really personal at point because of what we went through, especially for the past 2 months. It was one of the very emotional kind of a moment of a healthcare worker, or specifically as a nurse. We have seen a lot. We have seen individuals who are suffering. We have seen people who really need help that you wish you could render, but unfortunately you couldn't.
How have health workers been affected by the loss of their patients or colleagues?
If I have to tell the truth, anytime that as a health worker you are coming to work, I just pray. I pray for those ones that are coming. I pray for myself. I pray for my family. I pray for everyone. I'm telling you, it's not easy. Sorry.
We have lost a lot of our colleagues due to COVID, and recently we have lost one of our. She was really the best nurse that I ever had, especially in my training moment. I'm sorry, she was a registered nurse at at Tokurangava Clinic, and I think she'll be buried tomorrow. She was really one of the best nurses, and honestly speaking, COVID has taken a lot from us. She was such a dear sister to most of us, and I have seen it, people talking about it. I'm not the only one who have experienced or who felt her, the pain of losing her. We have lost colleagues, and it's one of the most difficult moments for us, because regardless of what has happened to them, you have lost someone who is close to you, your colleague, but you still have to come here and do what you have to do.
Are you able to shed perspective to the extent of the psychological impact the COVID-19 virus as a whole has had on frontline healthcare workers?
When you have gone through many difficulties, it just makes your resolve. I know there were times when you announced in one day, I remember in one day we announced 150 people who have died. It's depressing. But at the same time, there is one word which should never be in your vocabulary, that's surrender. Never surrender.
Does the Ministry of Health still have hope of defeating the pandemic?
The poliomyelitis outbreak in Namibia also serves a very good lesson to us, because we never had such a massive operation of that scale. We did have an outbreak in the north of plague at the beginning of the 90s, which we also brought under control. But one thing which we learned, and what is critically important, is the fact that, you see, when you are dealing with an outbreak, the impact on the public is quite immense. And the first thing is to manage the public. Now, how do you manage the public? Because the first thing the public know is that there is a danger. Now, how do you manage the public in the event of panic? Is to give information. Information dissemination is critical. What type of information you need to give to the public? You inform the public what is the danger. This is the danger. In the epidemic, in the outbreak, in the pandemic, you say, this is the danger. This is how it can do to a person. This is how you can get it. And this is how you can prevent yourself from getting it. Those points are critically important to the public. You shouldn't allow a situation for the public to say that it's their problem. Everybody must own the problem. And it's only when you all own the problem, then you can move forward.
What do you make of the different myths surrounding vaccines?
People are talking about chips, what they want to kill the Africans. I was listening to one video, somebody was saying, if those people, they want to kill you, they will kill you through your first cell phone and not through the vaccine. Because it is easier. Everybody has got a cell phone, and if they want to put in something to harm you, they'll do that. But there is no these are people of ethics. There is nobody who would want to do harm to anybody in that fashion. And therefore our vaccination campaign is safe, and we really appeal to the public to cooperate with us so that we can reach a situation where we achieve herd immunity. And then when we achieve herd immunity, we will be like those people you see in Europe watching football. They no longer wear masks because all of them have been vaccinated. We want to reach that stage where we can say that we have achieved herd immunity. We will say no more wearing of mask. You can shake hands, you can hug one another, because you are all protected. That's what we are striving, and we can only reach that through vaccination.
In light of the Heroes Day celebrations, what message do you have for all health personnel, frontline workers, as well as everyone in the health sector?
On the 26th of August, it is Heroes Day in Namibia. And I want to give a message of congratulations and commendation to the healthcare workers. My team I have worked with, those in the regions, those in the hospitals, those following up patients, those who are seeing the one who lost their loved ones, the whole response team. I want to congratulate them, give them my thanks for the commitment they have shown for the service to the Namibian people, and just to encourage them to say, let us still continue. The war is not yet over, but the time will come when we can actually rejoice in the fruit of our labor.